Welcome to Sustainable Health Empowerment's Health Education Series. My name is Mark Bannigan. I'm a fourth-year medical student at Oakland University William Beaumont School of Medicine, and I have been a volunteer for SHE for nearly 7 years now. I've helped participate in and helped plan the inaugural medical mission trip to Cambodia in 2015. In today's telecast, we're going to be discussing cancers of the colon or rectum, otherwise known as colorectal cancer. We'll explain what it is, what can cause it, and how it's treated. So let's get right into it. Cancer of the colon and the rectum. This module is about cancer of the colon and rectum. Cancer that begins in the colon is called colon cancer, and cancer that begins in the rectum is called rectal cancer. Cancer that starts at either of these organs also may be called colorectal cancer. The colon and the rectum are part of our digestive system, which processes the food that we eat, absorbs nutrients, and eliminates waste in the form of stools, also commonly known as poop. After food travels down your esophagus, through the stomach, through the many folds of the small intestine, and then passes into the large intestine, and the first 6 feet of the large intestine is known as the colon, and the last 6 inches consists of what's called the rectum and anal canal. The job of the colon is to remove water and nutrients from the food and turn the rest into waste. This waste is known as stool, feces, or poop. So let's discuss the risk factors of colorectal cancer. More than 90% of those diagnosed with this cancer are over 50 years old. Colorectal polyps are another risk factor. Polyps are growths of the inner wall of the colon or rectum. They are quite common in those that are 50 or older. Most are harmless, or what's called benign. But some can become cancerous. Removing polyps reduces the rate of colorectal cancer by 50%. Family history can contribute to colorectal cancer. If a close family relative, like a brother, sister, parents, or children, had colorectal cancer, you're at a greater risk, especially if they developed it at a young age. If many close relatives have it, you're at even a greater risk for colorectal cancer. Personal history can contribute to colorectal cancer. Women with a history of any female cancers, such as breast, uterus, or ovaries, are at somewhat of a greater risk for colorectal cancer. Also, if you've had colorectal cancer, it is possible for you to develop it again. A person with inflammatory bowel disease, such as ulcerative colitis or Crohn's disease, will also be at an increased risk for colorectal cancer. Diet is a very important risk factor of colorectal cancer and one of the most important ways to prevent it. Diets that are high in fat, lower in calcium, low in vegetables, fruit, and fiber will place a person at greater risk of developing colorectal cancers. Things like animal meat, such as beef, are high in fat and cause an increased risk for colorectal cancer. Smoking is another important risk factor, and smoking cessation or stopping smoking can help prevent colorectal cancer. Smoking also places a person at greater risk of getting polyps and cancer. Let's see what we have learned. The last 6 inches of the large intestine are called what? Your following answer choices are the anal canal, the rectum, the colon, or the large bowel. Remember, multiple answers on this list may be correct. There were 2 correct answer choices, as this part of the bowel has multiple names. It could be called the anal canal or the rectum. Screening and diagnostic tests are important to find and remove polyps early and to detect cancer before you even have symptoms. Treatment is more likely to be effective if the cancer is discovered early. Let's talk about testing and screening for colorectal cancer. These are some of the tests and procedures that can be used to screen for colorectal cancer. Most common in the United States are the fecal occult blood test and the colonoscopy. If you are 50 and older, at high risk, or have symptoms, you may be asked first to do a fecal occult blood test, where you collect a sample of your stool on a card and mail it in for examination to see if there's any blood in the stool. If that comes back positive, then you will likely be scheduled for a colonoscopy. Anyone reaching the age of 50 is usually referred for an initial colonoscopy for screening purposes. After that, the test is repeated at regular intervals of 10 years or less, depending on the findings, risk factors, and new symptoms. But again, for those with family members who develop colorectal cancer, you should be referred for a colonoscopy 10 years earlier than the age of the family member when it was first detected, or as soon as possible if you are older than they are, even if you are not yet 50. So let's talk about the procedure. A colonoscopy involves, first, a day of preparation where you can only have a clear liquid diet. This includes things like apple juice, clear broth, plain coffee or tea with no creamer, green or yellow jello, and other liquids you can see through, but nothing red or orange that could make it look like blood. Later that day, you will have to take laxatives to clean out your colon. On the day of the procedure, you'll be given some kind of sedative, so the good news is you won't remember anything. A doctor will slide a scope into your rectum and explores as much of the colon as possible. If there are any polyps, they will be removed. The procedure is usually over within 30 minutes. A common symptom of colorectal cancer is a change in bowel habits. Symptoms include having diarrhea or constipation, feeling that your bowel does not empty completely, finding blood in your stool, which can be very bright red or very dark, finding that your stools are narrower than usual, frequently having gas, pains, or cramps, or feeling full or bloated, losing weight with no known issues, feeling very tired all the time, having nausea or vomiting. Remember, there are other things that can cause these symptoms that are not cancer. But see your healthcare provider, especially if you see any dark stools as thin as a pencil, or if you have a recent change in bowel habits. Other things you should see your doctor for are if you're losing weight without any known reasons, are unusually tired. Remember that there may be no pain to alert you that there is a problem. What's most important is getting regular screenings. Let's take another moment to look at what we learned. What may prevent colorectal cancer? The potential answer choices are a high-fat diet, finding and removing polyps, or reducing fiber in the diet. The correct answer here is finding and removing polyps, which is why getting your colonoscopy and having proper colorectal cancer screening is one of the best ways to prevent this cancer. Reducing fats in your diet and increasing the amounts of fiber are good ways to prevent colorectal cancer. There are many options for treating colorectal cancer, and it is very successful if caught early. Surgery, chemotherapy, and/or radiation therapy may be recommended, depending on how much the cancer has grown and whether or not it has moved somewhere else. The most important thing to remember are 1. To speak to your healthcare provider about screenings, especially if you have any risk factors or if you're 50 and older. And number 2, to immediately report any symptoms. What can you do to reduce your chances? Again, we are talking about things that you can do to change, known as modifiable risk factors. Eat lots of fruit and vegetables, which can help you get enough fiber, and also try to make sure you reduce the consumption of fat and meat. It's also very important to stop smoking if you smoke. Thank you so much for tuning in, and be sure to check out all the episodes in this health series on our YouTube channel at Sustainable Health Empowerment. We'll see you next time. Here's to good health and good habits. Thank you.